Well, and you're a specialist in nursing ethics, and this conference is on the ethics of care. Do you have views on how the ethics of care is relating to nursing ethics as a discipline?
Yes, I do, because in the early days of nursing ethics, I should say the journal will be 20 years old next year, so it's been established for some time. But in the early days, there was a lot of discussion about the relationship between nursing ethics and medical ethics. And again, there was some oversimplification. People said nursing ethics with an ethics of care and medical ethics with an ethics of cure. And there was a tremendous emphasis on gender. And of course, most nurses are female, we know this, but this does not necessarily mean that our ethics needs to be gendered. In fact, I think that's very detrimental to the profession. So what I would say is, yes, of course, ethics of care, nursing ethics should be and is very sympathetic to ethics of care, but it is not the only theoretical, philosophical position. Virtue ethics, of course, which relates very much, is very strong. And historically, the literature says that nursing ethics began as a virtue ethics, and many of those virtues we would not say are very helpful today. Obedience, very subservient virtues. But there's been a renaissance of virtue, and I think that's very, very positive. So it's not just about care. We do look at justice and respectfulness and so on. But also, of course, there's a lot of work still on deontological, utilitarian, phenomenological, narrative approaches to ethics. So I think, of course, ethics of care finds a very natural home in nursing ethics, but it's not the only perspective. And I think we need to keep an open mind and about how these perspectives interrelate. And the final point is, as I've also said before, is about interdisciplinarity. Ethics does not have all the answers. We do need to look to, as I said, social psychology, sociology, and other disciplinary perspectives to illuminate the complexity and uncertainties of everyday care.
Thank you.